Blessing Jung. I'm 19 years old and I'm from Guatemala, a small country from Central America. I arrived in Uganda on November 25th and stayed there for almost 2 months. I decided to come on this trip because I'm a medical student currently in the second year. I also wanted to learn and get some medical experience to continue my career with motivation. I still know very little, so there are many things I couldn't help with. My first week was not very busy, so I started socializing with Bethesda Medical Center staff. I was interested in learning local language, so they helped with some Ugandan words that would help me to survive during my time in Uganda. When that happened, I realized how kind Ugandans are. That weekend I went to Kapkora, a town in the eastern region of Uganda, with Dr. Shine Shin, Michael and a nurse. I was excited because this would be my first time on a theater attending surgeries. The surgical camp took place in Kapkora General Hospital. It lasted 4 days. The first day Dr. Shine started checking some patients that would be operated. That's when I saw for the very first time clinical cases like lipomas, hydroceles, hernias, and more. That day at the theater I had the simple task to pass the materials they needed like cotton, povidone, stitches, blades, mesh, saline water, etc. We couldn't attend as many patients as we had planned by cause of time and place conditions. I thought I would faint in the middle of some surgery, but it didn't happen. I was truly surprised and shocked how the human body is, and I realize how important anatomy is. Dr. Shine worked with some local doctors who helped him during the surgeries. They were really happy because Dr. Shine explains them very well every procedure they were doing. The second day we arrived certainly early right away to start surgeries. I always organized a small desk where I had all the materials. I left everything handier for the nurse and the doctor. This day was really exciting because I did things I have never done in my life before, like injecting antibiotics vaccines. At the beginning I was scared because I didn't want to hurt the patient, but one nurse from the hospital taught me how to prepare the vaccines because some of the medicines are on powder and they need to be mixed with water for injection. After that, Dr. Shine just told me to inject this patient and I already knew how to do it. All surgeries cases were different and I could learn something from each case, from children to adults. We also had the opportunity to work with the anesthesiologist for the children's surgeries. I was legitimately amazed about one child's surgery. This kid had a big tumor on his back made of bone. Everyone in that room was surprised. The third day I started to feel more like into it, more skillful, because at the beginning I struggled confusing everything. I also learned the basics of surgery and all types of kits that are needed depending on the surgery. We shared that theater with the hospital, so I also had the opportunity to see for the first 2 caesarean sections. I was amazed. This day I learned the most important thing of every surgical procedure, that is the protection and security measures. We had a patient with HIV positive. At the beginning we didn't know about it, but in the middle of the surgery, one of the local doctors told us that this patient was HIV positive, so right away the surgery stopped and everyone started to get double protection like double gloves. I finished that day shocked because I have never been this close or exposed to this kind of disease. Fourth and last day of surgeries I was feeling sad because this surgical camp was about to finish. We were running out of surgical materials and I was amazed how Dr. Shine managed everything to finish without struggling. Every day we finished sterilizing the tools and packing them for the next surgeries with a nurse named Moses. I helped to dry, pack, and label every surgical kit. During this surgical camp, we couldn't operate every patient because of the surgery's conditions, and some of those surgeries required more specialized equipment. We finished every day exhausted but glad. I'm thankful for this wonderful opportunity since I was able to develop my medical knowledge because I had the opportunity to see 49 surgeries less than 1 meter away. We went back to Kampala the next day. During my time here I couldn't help as much as I wanted to. Bethesda Medical Center is well staffed. There are nurses and health personnel to cover all the necessities of the hospital. When surgeries were booked at the hospital I attended them just to watch. I had the opportunity to watch a strabismus surgery with Dr. Bay, an ophthalmologist. I was amazed by how steady and precise Dr. Bay's hands are. He didn't hesitate at all. I was surprised about the tools of eye surgery set because they are extremely tiny, and stitches are smaller than the pinky finger. I'm grateful that I could witness this eye surgery because it's not a common case, and I could understand how strabismus affects the eye muscles and how the surgery can help. I also had the opportunity to work with an NGO called Vision Care, going to different communities to check eyesight. One of the NGO members taught me how to use a device that takes pictures of the patient's pupils and prints out a receipt. It was really fun for me, and I realize how human pupils are different and unique like fingerprints. Unfortunately, that first day working with the NGO I got sick, so that day at BMC I was cannulated with antibiotics and medicine for my stomachaches. We went every Wednesday to a community called Kajansi and Thursdays to Wakiso. I enjoyed my time there because I could interact more with local people, and I also practiced my Lugandan. I could see how important eye checkups are. Bethesda Medical Center closed for almost 2 weeks because of holidays. So that time I spent it with my Ugandan friend Ruth, a pharmacist from BMC, and with 2 Korean friends Joy and John. They are also volunteering for Vision Care. They showed me many places and how to move around in Kampala, and also I had the opportunity to know the Nile River, that is one of the largest rivers around the world, and Lake Victoria, the second largest lake. Uganda is becoming a developing country. Before coming to Uganda I thought, oh, Uganda is an African country, it may be dangerous, without water, and nothing to eat. I thought that everyone was dying of thirst and hunger, but is not like that. Uganda, the pearl of Africa, is a rich and beautiful country full of nature, green landscapes, perfect weather with nice and friendly people. This country is full of exotic food. I could try for the first time jackfruit fena, a big and funny looking fruit. I tried grasshoppers, they were delicious, and the most delicious pineapple I've ever eaten in my entire life. Uganda is a country with a great variety of food, fruits, and vegetables. BMC provided lunch for everyone, so I could try local food like pasho, matuk, cassava, bean sauce, chapat. Jessica, the cooker of BMC, cooks delicious because I tried local food from outside and it doesn't taste that good. I enjoyed my time in Uganda. It was a life-changing experience. Everything I did, like going to local markets, waking in the downtown, taking bodas, motorcycles, to move around, watching the city movements, how merchants work and move around. I realize that Uganda is developing fast, is not a poor country like social media presents African countries. There are many fancy and expensive places to go for dinner or just to hang out. I'm very grateful to Kampala UBF for the many shepherds and missionaries. I'm thankful for the time I spent here because I got to know more about God and His wonderful work. Since I came here I started Bible studies with Missionary Grace. She's also in charge of BMC drugstore. Every week whenever I have time I studied the Bible with her. I'm really glad because I needed someone to guide me through God's Word, and I could learn that I need to find my own God, not my mother's or friend's God. After BMC vacations with a Korean church from Kampala, Dr. Luke, Dr. Bay, Dr. Kim and her daughter Khan, she is also a med student. We had the opportunity to be part of a medical mission in another village called Moroto. Moroto is a town from Karamoja in the northern region of Uganda. We checked more than 350 patients including children and adults in just one day. My job was to take pictures of the patient's pupils in the ophthalmic station with Dr. Bay. But I moved around through the different stations where Dr. Luke and Dr. Kim were. I watched for the first time an ultrasound of a pregnant woman. I was truly shocked and amazed how babies can be. Some of the patients didn't know for how long they've been pregnant, but that machine helped with that. Dr. Luke was the busiest doctor that day. He checked babies, children and adults. It was like a never-ending line of patients. Some of them were not even sick, but they wanted to get medicine for free. We finished that medical mission very tired. This medical mission lasted 3 days, one entire day just to reach the place, 1 day of working and 1 entire day to go back to Kampala. In spite of the time, it was a good experience. Bethesda Medical Center also has a health center in Buvuma Island. I was about to leave Uganda, but I could leave the country before going to Buvuma Island. I was shipped off into Buvuma with a nurse called Barbara on Monday 13th. Someone at the hospital told me, "You're going to be carried by a man to the boat." I could understand at that moment. When we arrived at Jinga Trading Center, that is the place where the boats called water bus ships to Buvuma, I understood what they were talking about. A Sebo, man on Lugandan, carried me to the bus. It was a really fun experience. The water bus takes almost 3 hours to arrive at the island. They stop by different villages on the island to pick up more people, and I enjoyed the view of Lake Victoria. Buvuma Island Medical Center is in a small village where barely cell phone network works. The only patient I got to see was a farmer that cut himself with an axe. My 3 days there were beautiful. I enjoyed my time there, far from the city noise. People there are so kind and friendly, especially the kids. In the beginning, I was really scared about malaria on the island, but I knew God would protect me even though I ate 2 times a day because there are not many things to eat apart from fish. I had a good time. I left Uganda to my country the day after coming back from Buvuma Island on January 16th. I'm thankful to God because He planned for me this wonderful journey that changed my entire life, my perception of life and my way of thinking. I'm thankful because I could spend almost 2 months alone without any relative. I thought I wouldn't survive, but I did. God always put someone in your way that takes care of you. I'm thankful because God put on my way amazing people like my Ugandan friends from the hospital to my Korean friends who took care of me during my time in Uganda. They become true friends. I am thankful because I've gotten to witness many surgeries really close and even doing my part to help with it. I'm thankful to all the missionaries that are living in Uganda who let me into their homes, invited me for dinner and hanged me around. My entire perception of African countries changes. I leave Uganda in love.